things don't work. So going back, way back, 2001, so that's when I discovered this. And I call this the Toyos is crazy phase, because everybody I was telling about this, they'd say, what are you talking about? But I did a case report where I presented a case report where we actually had a dry eye patient with glaucoma, and we did IPL treatment on him. He was on several drops, his eye was dry, and he showed improvement. And actually, Asterisk gave me a research grant to try to look at this. So these are kind of one of the first IPL systems that I used, which was a really basic system. I would take rosacea patients, I do IPL, their skin would look better, and some of them said that their dry eye was better. Let me see if we can get a video going here. No. All right, so IPL isn't a laser, it's a xenon flash lamp. If you remember back to your chemistry, xenon is one of the stable gases. When you put electricity through that stable gas, it becomes unstable for a second, but it wants to come back to stability. And when it comes back to stability, it releases a light that has a large wavelength, anywhere from 400 nanometers all the way to 1,000 nanometers. What we're doing is we're putting a filter to block out those wavelengths of light that we don't need. What I've discovered, and this goes into low-level light treatment, is that the wavelengths of light that actually stimulate, photobiomodulate the mitochondria of the meibum cells are in that 600 to 700 range. So that's why we're putting a filter that's blocking out anything below the 600, because we want red to kind of stimulate that mitochondria. In the early days, the IPL system would just give you one big flash of light and be like, poof. And the problem is, with the thinnest skin of the face, if you gave them all that energy all at once, you would get scarring. So we had to figure out a way on how we could actually give enough energy to stimulate the glands to work better without scarring the thin skin of the lids. So how we did that is pulsing the energy. So when we give an energy level of IPL, we want to do some thermal relaxation, meaning that the energy is coming here and it's dissipating over a piece of territory. So energy, and then that energy dissipates. So that's thermal relaxation. So that's why we're pulsing this wavelength of light. And as described before, the first thing that we realized is hemoglobin in the blood vessels is actually absorbing these wavelengths of light in that 600 to 700 nanometer, causing coagulation and then disappearing of the telangiectasias. But we also know that these wavelengths of light can be absorbed by dark skin, so that's why it was very difficult at the beginning to be able to do somebody like me. You couldn't take an early IPL system and do somebody with any Fitzpatrick 3 or 4. Now with the new technology in IPLs, we can do Fitzpatrick 5 and even 6. And I'll talk to you about that in a little bit. And then I call this, okay, we believe you phase, because I started putting these videos on YouTube, and then people started to believe. Because before, people thought the meibomian glands just weren't secreting anything, and there was nothing in the meibomian glands, and that the meibomian glands were completely dead. But then I started showing these IPL, post-IPL expression videos, and these are the first IPL videos I put on YouTube. You could see that we were actually getting something out. So I call this the most severe, where it's toothpaste and very thick. And then, I don't know why that's doing that. It should give me that video. Well, it's not going to. So the question is, what is the mechanism of action of why this works? So we now know that IPL closes telangiectasias, it kills bacteria, decreases inflammatory mediators that are made by the skin. But if you ask me what's the #1 reason why IPL works, because it photobiomodulates. Anybody who's doing IPL knows, can you do IPL in this area right here? No. And why is that? Because it actually stimulates the thyroid. So IPL is actually a treatment for patients who are hypothyroid. Why is that important? He was talking about the Optolite pen. In the early days when we were doing these tests, we were finding that if we looked at Schirmers, there would be increased Schirmers. And the reason being is these wavelengths of light not only stimulate thyroid tissue, but it actually stimulates lacrimal gland tissue. So if we can give some wavelengths of light near the lacrimal gland for patients with Schirmers, with low Schirmers or like a Sjogren's disease, we can actually stimulate the lacrimal gland to work better. And then there's heat shock proteins. Heat shock proteins, if you give some energy and you cause some heat, whether it's with a CO2 laser, whether it's with low-level light treatment, whether it's IPL or anything, if you generate some heat and it's not too much heat that actually kills the cell, the DNA will make some heat shock proteins, and those heat shock proteins will make the DNA work better. So that's why CO2 lasers work to rejuvenate the skin, and that's why IPL works to keep the skin looking nice. So we want IPL to be on the skin so that these wavelengths of light will penetrate the epidermis and go to the dermis. It's the same way with low-level light treatment. So this is my patents from way back in 2013 looking at this. I've got several patents in terms of light treatments for dry eye. But we tried masks, we tried everything, and I'll show you some video here. But you don't want to do IPL this far away or this far away or this far away. You want to do it on the epidermis so that the wavelengths of light can penetrate to the dermis and stimulate the meibomian gland. Same thing with low-level light treatment. So this is the study that I led for approval with the FDA. We took two groups. One got sham with expression, and one group got IPL with expression. And what we found is that the group with IPL and expression actually had a statistically significant increase in tear breakup time. But what you can see here is that even this group that got sham with expression got improvement. So when doctors say, should I express or shouldn't I express, it's important to express. Even if you weren't doing IPL, if you were doing something else, you should express those glands. So when I have patients in my office and I'm looking at their lids, I'll just go ahead and I'll just express glands. That's actually going to help them. Expression's important. Then the other thing is the glands working. So these were expressible glands before IPL and expressible glands after, and you can see you get more expressible glands after you do IPL. That's really important because everybody thinks that glands, when you do mammography, they're gone. You're never going to get them back. But you will get them back. With repeated IPLs, it usually takes about, if you have a gland that's completely gone or dormant, if you do IPL, about 8 months later, you will see this gland come back. All right, I like showing this picture, and here's the reason why. This is a patient that had probing. What are these black spots here? Those are actually blood clots. So somebody was doing probing, the gland was like this, you probe and you dissect the gland and you cause scar tissue. And then this gland will never come back. What's going to happen is you're going to get a gland that's here and a gland that's here, but there's no connection here because somebody did probing. So if you were to probe right here, you would transect these glands. Transect, transect, transect. I don't understand why somebody would do probing, because you're just pushing that meibum further down. It doesn't make any sense. If you look at all the studies, there was a meta-analysis done of probing, and the only study that showed that probing worked was Dr. Maskin's study, who's the person who invented it. But nobody's been able to recreate his results. and then bringing back, photomodulation brings back these glands. So the things that I've observed, technology is improving, you're getting more and more, you're going to be seeing more and more IPL systems here coming the next year. So I've got about 5 IPL systems that I'm working with. They all have their advantages and disadvantages. People think more power is better, but it doesn't work that way. Too much energy will destroy the glands. Too little energy won't stimulate the glands. You want the right amount of energy. The way you do darker skin types is actually with pulsation. So one of the systems that I'm working with is the C-stem. The advantages of the C-stem is that you can actually do 5 pulses. So I'm actually developed parameters and protocols which we're going to utilize for FDA approval in the U.S. So, and there's again 3 other systems. So Luminous has their system, and it's a great system, but there's other systems that are coming down the pipe. All right. So low-level light treatment. So actually, this is the first low-level light treatment that I created way back in 2011. Red, and we tried red. We tried different wavelengths of red. We tried different wavelengths of blue. We tried infrared. Red works the best. Blue works as well. And this is just called the Q. So it's a little handheld system that patients can bring to their house and actually give themselves a little bit of energy to keep these glands motivated. Now, what's the difference between low-level light treatment and IPL? One, it's about 10 times more energy with IPL than you get with low-level light treatment. So if you're doing both at the same time, say you did IPL and low-level light, you're giving your patient 13 joules of energy, and then you're giving them 1 extra joule of low-level light treatment. I don't know if that 1 or 2 joules of extra energy is going to do more. So going to have to see the studies, but we've done the studies on low-level light treatment versus IPL. Where I see low-level light treatment to be something that can be used is for home use, like we use it. So what I do is I have patients do IPL. Once they're done through the 4 treatment protocol, they get one of these cues, either red or blue, and then they just do this at home. They have to do it at least twice a week. I got a lot of patients that will use this every day to keep their glands motivated. And that's one of my patents there. So I think IPL is here to stay. I've tried everything else under the sun, and I can't find anything better that's worked better than IPL. I think low-level light treatment has a place, and I think that's as a home use treatment to keep glands working.